All right. Thank you so much for joining our panel discussion. Today is May 18th of 2020, and we are having our Mask Off panel virtual show this month due to COVID-19. So our panel discussion is going to be virtual. So this month is May, and we're having it's Mental Health Awareness Month. Approximately 1 in 5 adults in the U.S., that's more than 43 million people, experience mental illness in a given year. So that's 21% suffer from severe mental illness disorder. Mental illness does not discriminate. It's affecting men, women, boys, girls, all ages, social classes. It doesn't care. Mental illness is real. Since 1949, the U.S. has recognized May as Mental Illness Awareness Month, with many organizations educating public about mental health. This month in May becomes the time that organizations get together and raise awareness about living with mental illnesses and strategies to attain wellness. Additionally, mental illness strives to reduce stigma, we reduce misconceptions, and we want to educate. We do fundraising, advocacy. We bring healthcare professionals as well to educate us about mental and emotional illness. During this epidemic time, mental illness has definitely increased in emotional illness. So we wanted to bring Markel. He's been with us doing our LGBTQ series, and he's brought some of his lovely friends along and healthcare professionals to help educate us and give us coping skills during this pandemic time, because we definitely think that not only are we personally dealing with things and our friends and family, but the world is dealing with it. And we just think it's time to just educate each other and help each other. And we all deal with things differently. And one thing that I know my psychiatrists and therapists have told me before is don't isolate yourself. And so right now we are all isolated. We have a stay in order. So right now our anxiety is up, depression is up, suicide is up, and you don't really have a way out. You can't really be out. So things that you used to do for coping, those things have been taken away from you. So you don't have your trigger everywhere you turn around. And so substance abuse is up right now. Abuse period is up, whatever form of abuse that is. So we just thought it would be a good time to just educate and bring awareness. And for you who don't know, Mask Off purpose is to provide a non-judgmental platform for people to discuss all concerns regarding mental and emotional health. Why do we do this? It's time to do something about mental and emotional health, not just talk about it, but to do something. And how do we do it? We are the glue to connect people to the right resources to begin their healthy journey for mental and emotional health. So Markel, I'm gonna let you go ahead and introduce the panel for tonight.
All right. Hello, everyone. I am Markel Jordan. I'm a licensed professional counselor. So some of y'all may have already seen me with Marquisa and the organization for doing some of these broadcasts. I do want to thank Marquisa and her team for all the work they do. They do a lot of work in the community. They give supplies to the homeless. They address mental health. They address domestic violence and domestic abuse. So they do a lot of different topics. They talk about LGBTQ concerns. So shout out to Marquisa for doing stuff like this in the community. But yeah, I'm a counselor. I've been doing it since 2014. I've worked 7 years in HIV/AIDS, dealing with the population that are doing prevention work and dealing with individuals who are living with HIV/AIDS and connecting them to mental health resources, doing counseling, and working with substance use, individuals who have challenges with substances, and working with teenagers. So I've done all that for the last 7 to 8 years, and I am grateful for the work. And so I have my 2 lovely colleagues. We work together doing university counseling with college students. So we have Dr. Aisha Evans, and we have Stacey. Stacey, I don't want to mess up your last name.
It's Appiah Opuku.
Okay, I'm sorry. I want to slaughter it. So a little bit about these ladies. I will talk about Dr. Evans. She has spent her career providing clinical services to adolescents and young adults in university settings. She is currently employed at the University of Texas at Dallas, whoop, 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 as a staff psychologist and liaisonship coordinator. Dr. Evans has a passion for outreach, community engagement, and diversity and inclusion. She serves in a leadership role on a center-wide diversity and equity committee, and as a member of multiple university-wide diversity and inclusion committees and task forces. Dr. Evans is a native of Cincinnati, Ohio, and she's proud of that. And she earned a PsyD in clinical psychology from the Chicago School of Professional Psychology. She also earned a Bachelor's of Arts in Psychology from Wright State University in Dayton, Ohio. She is dedicated to helping decrease mental health stigma in racial minority communities and providing inclusive services. All right, so thank you for joining Dr. Evans with us. And Stacey is a licensed professional counselor. She received her master's in clinical mental health counseling at Wake Forest University in 2015. She has experience working in behavioral health hospitals, K-12 schools, community mental health settings, and universities. Stacey currently works at the Student Counseling Center at the University of Texas at Dallas, where she is the clinical workshops coordinator. She also works at Empowered Healing Dallas, a local private practice. Stacey's primary clinical interests include suicide intervention and prevention, social justice advocacy, supporting immigrants and international students, and serving racial and ethnic minorities and working with children. So again, I'm glad Dr. Evans and Stacey was able to join me and Marquisa. It's always good to have educated, smart, dedicated Black women in the house.
Black women, yes.
And so thanks y'all for joining us.
Yeah.
No, one thing that when I was doing my research this week, and it's not rocket science, but people with pre-existing conditions, including anxiety, depression, substance abuse behavior, impulsive disorders, during other pandemics, such as when the AIDS was out, Hurricane Katrina, there was a big increase during other pandemics. There were a big increase in suicide rates, and it was a big increase in anxiety, depression, and it doesn't seem like we are ever prepared for mentally and emotionally. I mean, we're not prepared physically, financially either. I mean, we're not, but we're definitely not prepared mentally for what's coming. And during each pandemic, we are seeing, people are not only dying because of the pandemic, but people are dying because they can't handle it mentally. So some of the questions that have been brought to us, because like myself, I have anxiety and, depression and so on, it increases. Do I have COVID? When I go out, I'm looking, now, I'm OCD. So I'm like hand sanitizer, washing my hands thoroughly now. So now my anxiety is increased. People I have talked to, my loved ones, now your anxiety is in heightened. So people want to know from a professional. Not everybody has insurance, so we not everybody's able to, I'm able to talk to my doctor to Teladoc. Thank God for that service. So I know that there are services out there but everybody's not educated about those services like Teladoc or other free services, which we'll talk about later. But what are some things that you all can recommend if your anxiety is increased, if you're worried about your loved ones catching, COVID, and then it might be in your head, not necessarily a factual thing. You know what I'm saying? It's because of your anxiety, your disability is what they call it.
Mm-hmm. Yeah, I mean, one thing that I recommend, especially during a time like this, during a pandemic and something that none of us have experienced before, I think anxiety can really increase when we are watching the news a lot, when we're on social media a lot, and just getting all of this different information, especially a lot of conflicting information, because no one actually has the answer, it seems. So I think, and I have had to do this for myself, just limiting the amount of exposure to the news. Like, I really haven't been watching the news now. I have like one daily, like I get an email basically from CNN, and I'll just read the updates really quickly, and then I don't watch the news anymore. So that's one thing, because I think there's so much out of our control right now, that I feel like that's something we can control, is just like getting enough information to be informed, like knowing what the new, what phase we're in of reopening or things like that. But also taking our control of not overdoing it, or not, when we start to notice like my chest is getting a little tighter the more I watch the news, or I'm having trouble breathing, or I'm noticing muscle tension, to just kind of take that as a sign that that's enough exposure for today. So
no, I think the piggyback and echo Stacey, I think that's a great recommendation, because like she said, there's a lot of things that we don't have control over, but we do control how much we watch the news. We do control how much we scroll through social media and check CNN 100 times a day. And so I think you have to take back some control, and you have to, again, limit yourself. Like, hey, I'm only going to watch an hour a day, or whatever that thing, whatever it looks like for you. Because I know people who have gotten obsessed with the news and obsessed with watching it all day, having it planned in the background if they're working from home. And you have to give yourself a break from that.
Right.
Because it's definitely, you have to know, to kind of add to that, you have to know what your triggers are, right? If I know watching the news is a trigger, and I'm already dealing with anxiety and it's going to trigger it more, I need to pay attention to that trigger. If I know talking to certain people, right? Because I know people who have certain friends or certain family members that add to the hysteria. Have you seen what they said today? Have you checked today? And even though they're your loved ones, they're your parents, they're your siblings, sometimes we have to limit our conversation, or let that person know, like, hey, I can't talk about that today, right? You have to kind of put some of those boundaries, even with conversations, because we're all talking about it, whether you're talking about it at work or you're texting people about it. Did you see what the governor did today? And
conversation starter.
Yeah, it's definitely a conversation starter. So sometimes not only limiting what you see on TV and social media, like Stacey said, but even limiting or just creating boundaries, which you talk about with friends. Like, listen, today I don't want to talk about it today and tomorrow. I just can't. And so you have to kind of do that to kind of help manage the anxiety.
Got it. Makes sense.
Yeah. And I think that what we're experiencing is trauma, or vicarious trauma, and it's grief. And in dealing with those types of things, just really working on developing some self-care tools can be really important, like using grounding exercises and mindfulness exercises, even if it's just taking a moment to just close your eyes and envision a safe spot for you, like a spot that brings you pleasure. Just sometimes just taking a step back can be really helpful. And I agree with everything the two of you said. The social media, the media in general, it can certainly trigger a lot of things. So it is important to be mindful and aware of that.
Great, thank you. That definitely makes sense. I mean, even though we can't get out and physically, we can walk. You definitely can walk. I've been walking. Like you said, you can do exercises, grounding techniques. Now you can YouTube anything and find, how to do anything. So I definitely think, who you talk to, Markel's plays a different thing, because you're right. If you have those friends that are constantly putting those things in your mind and reminding you about those things you're trying to forget, those brings up triggers. And if you're watching the news all the time, and that's what I was doing. I was watching the news all the time because I wanted to stay up on the facts. I was thinking, I'm trying to beat the things. So I'm trying to stay up on, okay, I need to know what store I need to go to, what store I don't need to go to, or, so I'm in my mind, but I was driving myself crazy because I was thinking I wanted to be ahead of things, but I really was driving like, I need to go to Walmart today or Kroger today, you know, who I need to go. But it really was driving me crazy because I literally was consumed with the news and I was taking everything. I'm worried about what's going on in New York. I'm calling my people in New York. I mean, it's just consuming. I mean, it's all day. And before you look up, it's like, it's 5 o'clock. I ain't done nothing because I've been watching the news all day. So it's good. That is very good. Thank you for letting us know that. And then one thing too another thing is people are noticing a change in their sleeping habits. For someone that, like me, I got laid off from my job. So I talked about it with my therapist is, hey, my sleeping pattern is off because I had a schedule. So when I was on my 8 to 5 regimen, I knew I had a sleeping pattern. Now I'm not on my 8 to 5 regimen. So I'm up, you know, watching, I didn't binge watch all kind of Netflix, you know, so I don't have a time to get up or go to bed. So right now I'm sleeping. So I can't really tell is that really, you know, what's going on with me mentally and emotionally, like it, you know. And what do you all advice for someone whose sleeping pattern is off and you can't sleep? So now I feel like I have insomnia because I, you know, even though I haven't slept all through the day, I've been up because I can't really sleep when it's daylight, but now I can't sleep because, I mean, it, you know, so I really don't know. So how people are dealing with this right now.
Well, I think you have to, if you want to get back on a schedule, even though, like, let's say you're laid off, or let's say you're working from home, so it's easier to stay up late because you can kind of throughout the day kind of nap here and there. But it's like if you know that I'm more tired during the day, or even if I'm working from home, I can't finish the work, or if I'm in school, I can't really focus on my online classes because I'm sleepy. It's like getting yourself back into a routine. It's okay, I need to start going to bed earlier. I know some people are having a hard time sleeping, whether it's their anxiety or just like their body want rest. So there's all types of mindfulness activities. Even if you YouTube mindfulness and sleep on, like, how do I, and I know we talked about mindfulness. So for those who don't know, mindfulness is a technique that you can use that basically you center yourself, you calm yourself, and people do it in a lot of ways. They do meditation, they pray, they sit and do breathing exercises just to kind of center themselves. So a lot of times you can do that before bed. And some people, if you YouTube sleeping music, it'll pull up like jazz and some other like quiety music that you can play that kind of helps you get back into that space. Some people take, again, check with your doctor. I'm a counselor, I'm not a doctor. Some people use over-the-counter sleeping aids. But again, if you're already on medicine and all that, you probably need to check with your doctor to see if that's okay. But some people do use over-the-counter melatonin and all that. But I think being disciplined, get back on a schedule, doing some mindfulness, whether it's meditation, prayer, listen to music before you go to bed, something where I can quiet my spirit and quiet myself.
Yeah, I think sleep hygiene is really important. In doing the simple things, like, yes, it can be tempting to lie in bed and watch TV right before we go to sleep. Yeah, you don't want to do that. You want to make sure that you're unplugging an hour before you go to bed, and also only using the bed for sleep in addition to that. Those things can be really helpful. And sometimes, even myself, like, I find myself at night, it might be hard to fall asleep. Getting up for a little bit, not just lying there hour after hour, getting up, even if it's just for like 20 minutes and doing something light. Like maybe you had a couple dishes you didn't do or something like that to break up the monotony, and then trying to go back to sleep can be really helpful.
Right.
Yeah, I agree with all of that. And I think if the maybe trigger for the sleep concern is maybe a lot of racing thoughts and a lot of anxiety about, every day now, there's so much to be anxious about. So I sometimes, and it's funny, since we all work at UTD, I think we talk a lot about this with college students who are struggling with sleeping. So if it's related to anxiety, a lot of times I recommend like just journaling or writing down all the thoughts that are still in your mind, and just knowing, like, I've written it down, I'm not going to forget it, but this is not the time to attend to those. Tomorrow I'll attend to some of them, but it's kind of out of my mind, hopefully now. So that's one thing I'd recommend too, if someone is trying to go to sleep, but then just having constant thoughts. Yeah.
Okay, I like that, definitely. Worsening conditions. So we talked about, you know, increase in anxiety, depression. If you feel some people are having trouble contacting or getting a hold of their therapist, because not everybody's doing teledoc. I mean, not every therapist is doing that. So if someone feels like, and I have talked to people and friends, and they's like, you know, I don't know what it is. You know, some people they didn't even think they had anxiety until this whole pandemic, and they like, I don't know what it is. And I'm like, maybe it's anxiety. And of course you don't want to go around diagnosing people, you know, but people, we as people, we feel like we know what everybody have, you know. Especially if you have it, you like, yep, you got it, you know. So, you know, how would you recommend that we help others without offending them, or, you know, how to be there for someone? Because that's really what we're having trouble with, connecting with other people, especially when we're going through. So it's like my friend told me today, she's like, I really have been trying to call you because I know you've been going through your stuff, but I've been going through stuff too. You know, so it's like you don't want to really put too much on somebody, but you also want, you know, so we really don't know how to be there and connect right now. So how would you all help us with, because this is worsening for the ones that's already going through, it's worsening for the ones that's not had it. Now they're kind of thinking they might be. So how would you recommend?
I would say just being very intentional about reaching out to the people you care about. I actually had a conversation with a friend the other day, and she said, hey, you know, I just want to check on you and see how you're doing. And she said, I don't know how somebody's doing. I just don't want to assume that you're doing well and not ask. So I think that it just really starts with being intentional about checking in, asking the person, hey, how are you doing? Because sometimes you can get a lot just from doing that. And then also, like, if you are concerned about someone, commenting on some of the behaviors, some of the changes that you see, like, hey, you know, I noticed you haven't been reaching out as much lately, or something like that, to bring it to light, because that can hopefully help start a meaningful conversation as well too.
Right.
And let the person know that they're seen, that someone sees them, someone's paying attention.
Right. I mean, and honestly, right now there's really nothing to do. So for me, my increase in alcohol has increased. You know, I've increased my alcohol intake. You know, there's nothing to do. I'm at home. I know I'm safe. I'm not going anywhere. So a lot of my friends are increasing. You know, I went to the liquor store, like, yeah, we out of that. I'm like, yeah, out of that one, you know, because everybody's I'm getting mine.
Gotta slow down.
I gotta go to Kroger's to get the favorite wine. You know? I mean, people have noticed that there's an increase in whatever, a drug or alcohol, and we know that that's not healthy, but we don't know if it's because you're bored, it's because you are not emotionally or mentally stable. It's just like, if you're bored, you go eat. That, you know, people are doing that right now too. My friends are telling me, girl, I picked up a few pounds, you know, I'm bored. I'm feeling sad. I didn't, go to the refrigerator and eat. So people are dealing with it in different ways, and we not knowing how to, having the right coping skills. I think it's just because of lack of education. And that's why we offer the platform that we do, is just to provide just a way to educate others.
Can we back up just for a second?
Yes, please.
Because I want to, for the listeners, address this whole, I don't want to be labeled as crazy. I don't want to be labeled, meaning like mental health is a human condition. Absolutely. Just like physical health. Some people have headaches. Some people have cancer. It's a big spectrum, right? And so some people, yes, have been diagnosed, or even if they haven't been diagnosed by a doctor, they have been dealing with anxiety or depression way before this. They just haven't, for whatever reason, got an official diagnosis or got official help. Then, like a lot of us, situations happen. So in mental health, is what we call situational anxiety or situational depression. It doesn't mean you technically need a diagnosis. But the human condition is a pandemic happened. So situational is I have anxiety out of the blue because of this particular situation, right? So I think it's knowing that it's okay. Like, let's normalize that you're dealing with situational anxiety. That doesn't mean that you have an official diagnosis, and it doesn't mean that you don't. It just means right now I'm dealing with some of these symptoms because of the pandemic, or I was already dealing with it, and they have increased because of the situation, right? And like you said, going to the coping skills, is that I know when we are bored, and when we're not bored, like when we're just dealing with our symptoms, we kind of self-medicate, however that is. And sometimes when we're bored, we kind of self-medicate. So I think it's important to find things within your budget, because I know everybody's money is different. Just within your budget, within your community that you can do. And I know now things are opening back up, but still some people don't feel safe to do those activities. But there's a lot of things as far as like coping. Arts and crafts is very therapeutic, and I know a lot of grown people, especially grown men. I ain't gonna be doing no coloring book, And I know that sounds elementary, but research has shown that coloring is therapeutic, and arts and crafts is therapeutic. So you can go to Walmart and get a coloring book for 99 cents. And again, I don't want to count nobody's money because that still may be a lot for somebody, even $1. So I don't want to do that. But if you're looking at the small things to do, that you can cope. And again, like you said, I don't have the money for a therapist, or people who are watching this may live in a small town in Arkansas, right? That I don't have the ability to go to a therapist. So what do I do then? So there's other coping things like drawing and journaling, like Stacey mentioned earlier, and any type of like building. So even if you like building things, something where I can spend an hour a day that makes me feel good. I'm drawing, I'm coloring, I'm journaling. Every day I listen to my favorite singer at this time of day. So there's other little things that maybe it's cost effective, where if you can't afford, or even if you can't afford it, but just right now you're not ready to see a therapist. And we have to respect that too. There's other things that you can do to kind of help some of those symptoms.
Right.
So I don't know if Dr. Evans or Stacey has any more coping things.
Well, I have one other idea too. I've noticed, well, I guess even before the pandemic, but even more now, a lot. I know before I said stay off of social media when you can, but there are a lot of therapists who are on social media now, and they're posting so many great ideas for coping skills and different activities, and even just like journal, like prompts. If you do want to journal, like different things you can journal each day. And they're just posting to kind of normalize this whole experience. So I know you asked about, if you're noticing some patterns in your friends